Good afternoon, everyone, and welcome to our fifth webinar this year titled SOAR Enhances Income Stability in Native Communities. Just a few housekeeping items before we begin. A quick disclaimer: the views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of CMHS, SAMHSA, or HHS. Just a few webinar instructions. As you can see here, the slides, materials, and presenter bios are available now on the SOAR website. You'll also find the materials in the reminder emails that you received, and also you'll get these slides in an email following the presentations today. The recording will be available within a week on the SOAR website and also SAMHSA's YouTube channel. We'll take questions at the end of the presentation, so please submit these questions through the Q&A feature. As a reminder, all participant lines will be muted and the chat feature is disabled. We ask that you complete an evaluation that you'll be directed to a survey following the webinar. We also have a short poll question for you towards the end of the webinar as well. So the purposes and objectives today, it is our intention that you'll learn a little bit more about best practices for engaging and working with and gaining buy-in when working with Native individuals to complete SOAR-assisted SSI and SSDI claims, and also the unique challenges and opportunities for working with Native applicants and within Native communities as well. And to reach those objectives, we have presentations by Abigail Kirkman, Assistant Director with the SAMHSA SOAR TA Center. We also have Ken Vieg and Rose David, partners with Wolf River Consulting Group, and also Mylin Widener, who is a SOAR-trained caseworker and PATH liaison in Billings, Montana, who will share a SOAR provider perspective as well. And then again, we will have plenty of time for questions and answers at the end. So we are very fortunate to have today Asha Stanley, our project officer with SAMHSA, who will do today's welcome. Asha?
Thank you, Pam. A warm welcome to all of you joining us today. On behalf of SAMHSA, I'd like to welcome you to this webinar titled SOAR Enhances Income Stability in Native Communities. There are 574 federally recognized tribes in the United States. Each are sovereign nations with their own history, cultures, and services. Just as each tribe is unique, so is each SOAR application. Native individuals make up a disproportionate share of the people experiencing homelessness, and many face unique challenges in accessing SSI, SSDI benefits. In this webinar, representatives from both the systems and community level will share best practices for engaging Native individuals to complete SOAR-assisted SSI, SSDI applications, and discuss strategies for gaining buy-ins for SOAR from Native communities in both urban and rural settings. I'd like to welcome and thank our presenters for your willingness to share your expertise with us. I will turn it back over to Pam Hain, who will be moderating today's webinar.
Thank you so much, Asha, for your support. So first up, we do have Abigail Kirkman, Assistant Director, who's going to start things off for us today. Abby?
All right, thanks, Pam, and welcome everyone to our webinar today. We are so excited to share great systems level content with you, as well as hear from a caseworker who is doing the work in Native communities in Montana. So at the SOAR TA Center, we have been really committed, especially over the past couple of years, to expanding our reach and knowledge of completing SOAR applications and building SOAR initiatives in Native communities. And to that end, we have created a series of documents, which I'll review with you. And we also have a dedicated section of our website entitled SOAR and American Indian Alaska Natives that I really encourage you guys to go and visit often as we continue to update it with new resources. So 3 resources that we are really proud to have debuted last year are a couple of documents that we find can be very helpful for those who are working within Native communities or are just beginning the process of working with Native individuals. The first is our SSI and SSDI eligibility FAQs for American Indians and Alaska Natives. And this document really answers a lot of the common questions that individuals have. So can Native individuals apply for SSI and SSDI benefits? What about children applying for SSI? How can their living situation, whether it be on a reservation or in an urban setting, affect their eligibility? And then also, what's the best way to collaborate with tribal governments? Once individuals have those questions answered, oftentimes they want to know how they can get involved with SOAR. And we have created a specific document entitled Getting Involved with SOAR in Tribal Communities that really talk about the expectations of becoming involved in SOAR and what they can expect when working with applicants. And then many individuals have, caseworkers, agencies, communities have wanted to build a SOAR coalition or a SOAR initiative in Native communities or working with Native individuals. And to that end, we've created an implementation guide for state and local SOAR initiatives within those communities. And really that just provides a lot of guidance and best practices around who to collaborate with and how to build a successful SOAR initiative. Next slide. So for those of you who have been involved or invested in the SOAR world, these documents are probably something that you have seen often. So the MSR interview guide and template with the medical summary report, of course, being one of the cornerstones of the SOAR critical components, and also a SOAR sample application, a sample referral application to really get those individuals who are in need into those services that are offered in communities. So for these, we really tailored them to Native communities and to working with Native individuals. We asked additional questions that may be relevant to the SSI and SSDI application and really tried to hone in on experiences that Native individuals may have or trauma associated with their past that may be vital when telling their story in the medical summary report. All of these documents are located, like I said, in that dedicated section of the SOARworks website as well. And so one of the things that we are really excited to release in May, we are looking forward to releasing this toolkit. And this toolkit really combines new information on best practices for engagement, as well as includes all the documents that are on that SOARworks website and many that we showed. And it's just a really great landing point for individuals who are looking to become engaged in serving those in Native communities. So some of the contents that you can see right here are how can we help people in Native communities gain access to these services that are so vital? What are some challenges that youth or adults in Native communities may face? And so it's a really great look into how you can become and better understand Native communities before you begin to incorporate or build an initiative in there. And a huge shout out and thanks to Kim and Rose from Wolf River, who you'll be hearing from next, who really put a lot of time and effort into this guide. We're excited to debut it, and we're really looking forward to the feedback that we'll hear from the wider SOAR community. All right, and with that, I am thrilled to introduce Rose David and Kim Viju, both of Wolf River Consulting, who are really going to take us through some really vital information to know when working with Native communities. So I will hand it over to you guys.
Wow. Good afternoon, everyone. Welcome. Thank you for joining us today. My name is Kim Viju. I am the partner at Wolf River Consulting. I'm a member of the Oneida Nation and a descendant of the Menominee Nation of Wisconsin. I'm joining here today from Chicago. And just a little bit about my background. I bring about 20 years of experience working with within the federal government in agencies serving tribal communities, and then more recently started Wolf River Consulting to continue that work with tribes. And so we were very fortunate about 2 years ago to start working with SAMHSA
on the SOAR program. So very excited to be here and introduce and roll out some of these new products. Rose?
Hi, my name is Rose David. I'm from Chimnasing First Nation. I'm a Anishinaabe. I am a partner at Wolf River Consulting with Kim, but I will go more into my background once we get into the slides. But thank you all for joining today, and I'm looking forward to the next hour.
Okay, so what we wanted to do today was give everyone that is with us a little bit of background on understanding the Native communities that they serve. So we'll take you through, some very basic statistics, and then get into more detail about why some of these issues and things that exist within Native communities, and then how you can continue to serve the Native individuals that you serve. So this is here a map of all of the federally recognized tribes in the United States. Currently, there are 174 federally recognized ethnically, linguistically, and culturally diverse nations. They're also referred to as tribes, nations, bands, pueblos, communities, and Native villages. A lot of these are in Alaska. There are 229 federally recognized nations or villages in Alaska. There are 345 federally recognized nations across 35 states, and then 60 plus state recognized tribes that have formal relationships with state government. There are a number of states that don't have any federal lands or reservations. I'm in Illinois, which is one of them. So we'll get into that more about how that kind of shapes how you serve your Native clients. Next slide. And then just a little bit more about some general statistics about Native communities. As of 2020, there were 5.2 million people in the United States that identify as American Indian or Alaska Native. These are self-identified American Indian or Alaska Natives. It does not include just people who are citizens of a federally recognized tribe. So this could mean that a person is ancestry is made up of multiple tribes, or they are multi-ethnic, multiracial. This is a statistic that surprises most people. About 70–80%, 7 in 10 Native people live in urban, suburban, or non-reservation lands. Indian country is very young, with the 29% of the population is under 18 years. You'll find that in other states, like in the Dakotas, the population of young people is much higher. Unfortunately, about 26% of Native people live in poverty compared to 4.6%. Many of the homes on reservations lack access to safe water and waste disposal facilities, and the life expectancy is about 4 years less than other races. So that's attributed to chronic conditions like liver disease, diabetes, as well as injuries, assault, self-harm, and suicide. Next slide.
I'm back. Hi, this is Rose David. So I'll be doing the next few slides. I'm going to keep my camera off, but because the older I get, the more my allergies affect me. So I'll be drinking water during this time. So I just want to go into a little more of my background. Like I said, I'm from Chimnasing First Nation in Ontario, Canada. And my dad is, and that is on my mom's side, Bear Clan. And my dad is born and raised Native Washingtonian. So I have the ability to walk in a few worlds. And I currently reside in Washington, D.C. and for those that have been here, in the Adams Morgan area. So I'm able to travel back and forth. As far as my previous life, I used to be a training and technical assistance coordinator for the Native American Center for Excellence at SAMHSA, which I now believe is Native Connections. So we will go ahead and get started. So this is a pretty heavy slide, understanding tribal sovereignty. So I'm going to spend some time on a few slides, more time than others, and then so we can focus on a few major points, and then touch on a few of the other slides. And any other resources I mention during my presentation, I will put in the chat after Kim and I have concluded our portion of the presentation. Okay, so tribal sovereignty. Native peoples and governments have inherent rights and a political relationship with the US government that does not derive from race. Tribal citizens are citizens of 3 sovereigns, their tribal nations, the United States, and the state in which they reside. They are also individuals in an international context. So what is sovereignty? Sovereignty is a legal word for an ordinary concept. It's the authority to self-govern. There are hundreds of treaties, along with the Supreme Court, the President, and Congress, that have repeatedly affirmed that tribal nations retained their inherent powers of self-government. So treaties, executive orders, which I'll go into in a later slide, and laws have created a fundamental contract between tribal nations and the United States. As sovereign nations, federally recognized American Indian and Alaskan Native tribal nations have a government-to-government relationship with the 2 other sovereign governing bodies of the United States. So these are both modern and historic relationships between the tribal governments, the federal government, and state governments, which is outlined in the US Constitution. So it is the obligation of our federal government to protect tribal self-governance, lands, assets, resources, and treaty rights. And so a few other terms that you may hear is the trust relationship. So the federal trust responsibility is one of the most important laws in federal Indian law, and it derives from treaties between tribal nations and the US government. It is the obligation of our federal government, all the branches and agencies, to protect tribal self-governance, lands, assets, and resources, and treaty rights. So I'll just touch on this briefly. So I've worked in a few federal agencies as a federal employee, and in our federal agencies, we have what is a tribal advisor, and most tribal or most federal agencies do have a Native American office or point of contact that people can reach out to, if not numerous employees that within a Native American office within a federal agency. So I just want to touch on the treaties. So US treaties with tribal nations have the same status as treaties with foreign nations. And because they are made under the US Constitution, they are supreme law of the land. Some other terms that you may hear within your work in internet travels is self-determination and self-governance. Next slide, please. So using the appropriate terminology, I'll let you guys read through this slide. But for me, when I'm traveling or when I'm meeting new people, I am referred to as Rose. My spirit name is also South Sky Woman. I prefer to be referred to as Anishinaabe, Ojibwe, or from my Chimnasing First Nation, or just First Nations. So it's up to an individual. Never generalize. Always use present tense and utilize contemporary examples. And people, individuals, or communities will let you know how they would like to be referred to. As each tribal community or tribal government, reservation, pueblo has their own system of government. You will run into tribal presidents, executive directors, councilwomen, vice chairs. So each tribal community or nation has its own system of government and will have their own names that they refer to their elected tribal officials. So that's just something to look into before you approach a tribal community and in the work that you conduct with them. Next slide, please. Urban Indian communities. So I've been doing a little reading recently more about urban Indian communities, as of last night, actually, about Chicago, where Kim is currently living, but I'll go into that in a second. So urban Indians are tribal members who are currently living outside of the federally defined tribal lands in US cities. For urban Indians, government policies forced relocation in the 1950s, and there were also termination policies that forced assimilation into non-native culture. And they have had, let's see, Indigenous people have come to cities for education, employment, or housing opportunities and healthcare needs, resulting in an Indigenous urban population that is diverse and intertribal. So I was reading about Chicago last night, and I didn't know that Chicago is the third largest urban Indian population in the US. They have more than 65,000 Native Americans within the greater metropolitan area, and they represent over 175 different tribes within that community. As you know, Chicago is surrounded by waterways, so it used to be a really big trading hub, and that has just continued as more people have come into the city. I would encourage everybody to go to the National Congress of American Indians. They have a really good resource that is Tribal 101 of sorts that goes through tribal sovereignty, treaties, the historical relationship between our governments, and also into present day health disparities, education disparities that American Indian and Alaska Native peoples face. So it's, I will put that resource in the chat, but it's really good about explaining the relationship, and also provides a lot of resources. That is what is happening within this current administration and past administrations, and the resolutions about what tribal nations are facing and how they would like to work with the tribal government with their government to government relationship. So it's very interesting. So I'll put that in the chat in a little bit. And I think I'm turning it back to Kim.
Okay. Next, we'll be talking about some of the challenges that Native youth and other populations face in the United States. I know through SOAR, there's a specific focus on youth and foster care. So this is particularly relevant. Suicide is the second leading cause of death. That's 2.5 times the national rate compared for Native youth. 1 in 9 Native youth have reported a suicide attempt. The high school graduation rate among Native students is 74 versus 94 for white students. That is improving. This one is really sticks out. Native youth are arrested at 3 times the rate of the national average, and they make up 79% of the Federal Bureau of Prisons youth population. Native youth represent 8.4% of the foster care population. And that's really important to note that this is a high occurrence in the urban Indian community. Violence is prevalent. That includes intentional injuries, suicide, and homicide. And that accounts for 75% of the deaths among Native youth. There's some references here from the Center for Native American Youth. Also a great resource for facts, programming throughout the country. They're based in Washington, D.C., but they have a lot of programming nationwide, as well as best practices and some really encouraging stories from Native youth. And then also some information from the Department of Justice. Next slide. And then we'll go over homelessness in Native communities. This this is a little complicated, partially because of lack of data and data collection among Native people broadly, but also in tracking homelessness. And then again, culturally, because Native people don't always consider themselves homeless if they don't, even if they don't have a permanent address, but they're living with relatives or friends. It may not be tracked as being homeless. So with working with the information that is available, American Indian and Alaska Native people have the second highest rate of homelessness compared to other racial groups. And 1 in 20 American Indians and Alaska Natives are homeless versus 1 in 1,000. Over 10% of Native people in South Dakota, North Dakota, Alaska, New Mexico, and Minnesota are experiencing homelessness. And a lot of this is attributed to the lack of availability of housing. There are some very severe housing shortages on reservation lands and into urban areas. Next slide. And then the housing conditions on the tribal housing that is available is often subpar. 98.8% of tribal housing officials reported doubling up, and that means that people taking in family and friends in their house. So oftentimes the homes are very overcrowded, and 40% of the homes on reservation lands are considered substandard, and that means they're lacking sewer, water, electrical, phone, and internet access as well. Next slide. So there are a lot of factors that contribute to poverty, substance abuse, and homelessness in these communities, both rural, urban, and on reservations. And much of that is from historical trauma. And it starts from colonization, forced removal, boarding schools, assimilation policies, more recently relocation. I believe that this is becoming more well known. In the 1950s, many of the Native people, including my own parents, were removed from the reservation and forced into urban centers without resources or the ability to speak the language. And those assimilation policies and forced removal and displacement contributed to all of this intergenerational trauma that is, everything from suicide and depression, poverty, increased incarceration, violence, substance abuse, and PTSD. Next slide.
This is me. Recently during COVID, which is still occurring, and mostly Native communities are still recovering during this time, as I think we all are in different ways. So I always like to take a moment to reflect on the experiences that we've gone through and continue to go through before I begin talking. Okay, so let's talk about data collection and invisibility. So research, healthcare, and government institutions have always been interested in studying Indigenous communities. It's been a difficult effort. It's a result of historical mistrust between institutions and Indigenous communities around the data collection, and reuse of data. Historically, oftentimes researchers would go into a Native community, gather data, and the communities would never see that data again, or the communities weren't approached in a respectful way. So what does this mean? For years, Indigenous populations have been excluded or underrepresented from national data, and that leads to a lack of funding, according to the federal data collection research by the National Congress of American Indians. So what does accurate data allow for? It would allow for tribal leaders to better provide services to their citizens. The inclusion of Native Americans in data could change federal budget planning, service provision, resource allocation, and tribal eligibility for federal grants. So there are also community barriers, such as getting out within the community, methodologies, and transportation to be able to collect this data. And I've worked with different groups that were out in the communities doing grassroots efforts, working on COVID, trying to ensure that the supplies were there. And it was interesting to see the relationship of people requesting the data through IHS, the Indian Health Service clinics there, tribal community members, and it brought up issues of sovereignty, data collection, and where is this data going? So it was really interesting to see a boots on the ground kind of case about the barriers and challenges that still exist in tribal communities and data collection. Next slide, please. So I'm going to try to lift up some positive things that have happened. So there are many supportive federal agencies and services. And through, all of the funding that has come out, CARES Act funding, American Rescue Plan funding, it's really increased the collaboration between federal agencies and even within federal agency departments, I feel, to really connect their programs together and to really lift up the resources that are being provided and the information and awareness about tribal communities and how we can all work best together to conduct this outreach and provide the funding that tribes need. Because we, it's funny, it's just funny, just coming from a place where it should be the tribes telling the needs and the resources. But I believe that, this new collaboration and increased, outreach to tribes and knocking down the silos between our federal agencies has really been productive. So I really do want to talk about tribal consultation for a little bit. So tribal consultation is a formal two-way government-to-government dialogue between official representatives of tribes and federal agencies to discuss federal proposals before the federal agency makes decisions on those proposals. So way back in 2000, there was an executive order 13175 that reaffirmed the federal government's commitment to tribal sovereignty, self-determination, and self-government. Its purpose was to ensure that all executive departments and agencies consult with Indian tribes and respect tribal sovereignty as they develop policy on issues that impact Indian communities. So during this administration, a memorandum was issued on tribal consultation and strengthening the nation-to-nation relationship via Executive Order 13175. So that required that each agency submit a tribal consultation plan, do a subsequent report on how it was going. So last year, you saw a lot of tribal consultation coming out and agencies really reconfirming their interest in connecting and having and lifting up the government-to-government relationship. And so it was really neat to see. And I think it's one of the best ways to learn about tribal communities is to attend one of these tribal consultations. You can find a list of upcoming tribal consultations on websites, on agency websites, and also on the National Congress of American Indians website. And you get to hear tribal leaders speaking about what is happening within their communities. And it's just really interesting. And again, one of the best ways, I think, to really learn about what's happening within the communities. See. Next slide, please. So I'm not going to spend too long on this slide. You may have heard 638 compacting and contracting. So it increases the control of programs and solutions implemented on tribal lands, and it's a transfer of funding and management from federal government to tribes. And then you can also see the BIA and IHS systems of care. So just to bring up one thing about tribal self-governance is there was an Indian Self-Determination and Education Assistance Act that came out in 1975, and it gave authority to many more funding, federal funding sources in tribal governments. So it authorized the tribal administration of programs, functions, and services funded by the Indian Health Service and Bureau of Indian Affairs, and what became the 638 contracting and compacting. Again, I don't want to spend too much time on that. So next slide, please. And then you can visit the different websites such as IHS, BIA, Department of Interior, and to look at what IHS facilities there are and what regions they cover and how our services provided out to tribal communities. And as Kim mentioned before, the National Council of Urban Indian Health here in DC, they also provide a really great overview on their website of health delivery services out to urban Indian communities. Next slide, please. And again, these are just some resources that you can look to do your own research on the World Wide Web. So there's a great federal recognized tribes directory at the Bureau of Indian Affairs. So it'll give you a list of all of the current tribal leaders. I believe it's still updated relatively on a regular basis. And then again, I mentioned Indian Health Service facilities. And then you can see by going to this link that all of their different locations in the communities that they cover. It is also included in the toolkit that Abby showed in the beginning of this presentation for a few states, I think Washington, Montana. And then urban Indian organizations, you can go and visit who is serving our urban Indian partners. Next slide, please. And strengthening the capacity to serve is tribal level engagement. So within tribal communities, as you may know, there are a bunch of different services that are being offered throughout the community. So along with their own government, you're going to see the hospitals and clinics, social services, child and family services, behavioral health, disability services, substance abuse prevention and treatment, Indian child welfare, and law enforcement. So these are all in connection. And again, not every tribal community will have the same level and access to services, but it's kind of cool to go to different tribes that you're interested in and see what level of services that they have and what's going on in their community. So that's just another great point of like self-exploration, is to look at what tribal communities are around where you live, or just ones that you're just interested in to go and explore and research more. Next slide, please. Is this you, Kim?
Yes, I'm back. So leading into following up with what Rose talked about, what services and supports are provided at the tribal level. This is just going a little bit more into those departments. And as Rose said, they're all different. It can really depend on the location of the tribe. The size really impacts what, the range of services are provided, and then also like what resources the tribes, economic resources the tribes themselves have to provide for their membership. So just some common agencies and divisions that you would work with when you are surveying a Native individual would be like the housing authority. They always have a housing authority director, and this can be funded or a program provided by the housing by HUD, or served separately by the tribe. Most tribal communities will have a behavioral health department and the range of behavioral health providers that can be social workers, psychiatrists, psychologists, and then within that, you'll see more often is traditional practitioners and wellness support, who they're often incorporated into the kind of Western and then traditional practices. Usually they will have a substance abuse and prevention treatment programs. Those can be inpatient, outpatient, depending on what the tribe offers. And usually they will also have a disability benefit specialist available. There will be social service divisions and a number of social workers and case managers. The tribal governments, they can vary from just the council, or they'll have a full legislative staff that you work with. And this may be really relevant when you are working to implement SOAR within a community. It often requires approaching tribal leadership, and that will entail like memorandum of understanding or a cooperative agreement. And then the urban Indian centers and organizations. So as you can see, if you go back to the Urban Indian Center program list, there are urban Indian centers which serve as community centers, and then urban Indian healthcare organizations that provide health services, and that can be from wellness checks, like full hospitals, dental clinics. It really depends on the location. Here in Chicago, the clinic does a lot of referrals because they don't have the full capacity to provide those services in-house. But if you're in a place like Phoenix, they have a hospital that is funded by IHS in the area. So it really depends on where you are, but most urban centers do have some level of service provided for their native community members. In order to access those services within the urban Indian centers and organizations, healthcare organizations, you must be a member of a federally recognized tribes in order to be eligible for that service provided by the Indian Health Service. So somebody who is a descendant or self-identifies as Native American would not be eligible to visit those clinics. Next slide. So this leads into just some suggestions. These are sort of generalizations about culturally appropriate engagement and collaboration with Native communities. And I want to point out that this isn't always specific to non-Native to Native people. As Native people ourselves, we try to follow these rules and use these practices when we work with other Native communities and organizations. And there can be variation. There's such diversity among like tribes and communities that there is variation, but just as a generalization, these are good guidelines. So first, be aware that there are cultural, linguistics, and spiritual diversities and many different customs and perspectives within each community. Also, when you are looking to engage a community, it's important to identify a tribal liaison. That can be somebody that you may have a working relationship, or somebody that you have been referred to that has a good standing in the community and can kind of bridge the gaps to introduce you to the appropriate tribal leadership or program director to help either with your SOAR program or your application. And so a suggestion is to create a receptive environment with offering their time, and that can be showing up with food, coffee, or a small gift of appreciation. this was a little complicated with COVID. We couldn't all show up with food, but a small gift or a small gesture of appreciation for their time is always appreciated. And then this is important to before approaching a tribe or a community, is to learn about their elected traditional and spiritual leadership, and then their decision makers. You can go to almost any tribe's website and see sort of their governance structure. They usually list those people. You can refer back to the Bureau of Indian Affairs Tribal Leaders Directory, and then look throughout their website for the leadership within all of their departments and services as well. They're almost always listed. If they're not, I would suggest reaching out to somebody within the community to help you kind of become familiar with their structure and staff. And then also to learn how to address them appropriately. Some tribal communities have a more formal environment, especially with elders. It's important to ask how they would like to be referred to. And then within government, the titles that are used vary widely. So you could work with somebody who's referred to as governor, president, council member. There is wide variation, so we suggest doing your research beforehand. And then the next slide. And then this is just continuing on. So when you're engaging and collaborating with Native communities, it's best to approach the communities with positive intent and be open to other ways of thinking and behaving. Things can, depending on where you are, things can move a little slower. I know that from my working in DC, where things were a little more fast-paced, there's this tendency to want to kind of give the communities a nudge and move things along, but to be mindful of that, of their pace and the complexities of their work environment may play a factor in how things are managed and approached. Pay attention and observe tribal members. Always remember that they're the experts in their own community. So before you develop a formal relationships, kind of refrain from offering any advice until you've reached the point where you've felt like you've listened and observed and gotten a real understanding of their needs. This one's really important, and this goes for the Native and non-Native community, is that we have to be patient. There are a number of barriers where that cause things to move a little bit more slowly, or where you may not have the trust that you need to kind of move things along. So don't take it personally. If you're met with initial suspicion or frustration, many tribal communities have had, for good reason, have had kind of not so great experiences with government and other organizations, either in feeling like that they've been judged or that they've been forced to assimilate to other philosophies and practices, or that just that they've been mismanaged or their relationship has been fractured. And then avoid using a Western and non-Native perspective. Always let them lead the way. They know best what works within their community. Next slide. So once you are working with a community and working in collaboration with them, we just suggest incorporating culturally based practices. So once you start the collaborative process, to try to research and utilize culturally community-based practices along with evidence-based practices. SAMHSA has a really great list of all these culturally and community-based practices. The National Congress of American Indians and the National Indian Health Board also have some really great resources to look into those. This is also very important to reinforce cultural strengths. To learn the community perspective, protective factors, and incorporate community traditions into programming. Many of us have seen the use of cultural practices as prevention in a lot of programming. And when you're working with a community, really impactful to allow them to incorporate those practices throughout all of their programming and prevention efforts and treatment. This is also important. This has been to honor confidentiality, respect the right of the tribe to control their data and information and public, anything that goes out, anything that's public facing. I know Rose had mentioned that, often tribes have researchers come in or data collected, and when it's released to the public, it's not always the most favorable. So anything that is collected should be done in collaboration with the tribe and shouldn't be released without the tribe's permission. And then be flexible. It's important to adapt to the community's pace, many of their changing needs and traditions. This is really important now. And COVID is winding down, but in some communities it had a substantial impact, and are still feeling those effects today. Next slide. Okay, so I'm offering some of my personal and professional experience here. I had led a number of tribal health and education programs within the federal government, and found that these best practices work for delivering your messages within communities. There are a number of things why this is important, and so there's, depending on the geography, there's wide variation in technological access. So before you engage with the community, kind of try to look into and research and determine the appropriate communications channels. In many rural communities, there's lack of reliable internet service. And many communities have adapted by using more cell phone and mobile devices. So if you are, creating a website or any sort of materials, you want to make sure that they are mobile friendly, because many of your clients or the communities you're working with may not access them from a desktop or a laptop. They're accessing everything from their phones or a tablet. And then digital access is limited in a lot of tribal offices and libraries and schools. So if you are relying solely on emailing a community or a liaison within the community, the delay in response might be because their access is limited in the workplace to internet and reliable access to internet. Excuse me, I'm losing my voice. And then once you have shaped your message and you're ready to engage with your audience, consider that all forms of communications are needed. So one of the most effective ways is word of mouth. And word of mouth is important within tribal communities because it builds trust. Print materials are still very important. I would not suggest relying entirely on electronic communication. Flyers and print materials are really effective in placing throughout the tribal community. Visually, they're small, and people are kind of passing through many of the same areas, like community centers and tribal colleges and health clinics. And so those really high traffic areas will be full of flyers and brochures and are all well read. Another area that kind of maybe bypassed in more mainstream communication efforts is radio, but in tribal communities, the use of tribal radio is really common and really impactful. There's a large network of tribal radio stations, and some of them have a very large reach. There's some national programming, and then each tribe will have their own small radio programs. A lot of them will work with outside organizations in reading public service announcements, any sort of messaging, announcements about events. So they're great to work with and very collaborative in getting information out. They'll also allow community members to record in there as well if you're interested in having the community themselves get out the message. Social media always is very useful. This can be really useful in reaching youth. And then again, using mobile-friendly websites, apps, text messaging, and television. Next slide. And this is just some guidance for when you engage your audience. If you're looking to reach just an individual, this may be a bit different, but if you're looking to expand your SOAR program within a tribal community or reach a certain group like Native youth or a certain group of adults, these are some good suggestions. The main thing I want to suggest is that you use Native images and people, artwork, and the language throughout your materials as much as you can in anything that you're putting out. Because Native people almost never see themselves in any form of media other than like harmful imagery and mascots. So when they do see themselves, or they do see their language, or they do see their artwork, it catches their eye right away, and it builds that trust that is sometimes lacking. Just a suggestion to seek help from Native youth in the community to kind of shape your messages and materials. Ask them what they want to hear and what they think other people would respond to. And then identify and use trusted members of the community to deliver those messages. Always try to incorporate tribally specific photographs of people and their locations, their cultural designs, and their artwork that will resonate within their community. If you can, use words, phrases, and messages in that community's language or dialect. And then that would require working with someone in the community who's a fluent speaker to help translate. They will always be willing to help with that. And then very importantly, always get approval from the leadership before you distribute any messages or materials within the community or to the broader public. Next slide. All right, thank you. If anyone has a question or would like to reach out for any further information, Rose and I have our emails here.
Great. Thank you, Kim, and thank you, Rose, for sharing even more resources and your knowledge. So we'll have time for questions at the end. We want to make sure we get to Mylan Widner, who's going to really illustrate a few of Kim and Rose's last few slides on engagement. And Mylan will take us on a journey on how she represented an applicant for the good part of 18 months with her first SOAR-assisted application and share what she learned along the way. Mylan, do you want to come up on camera if you're able?
Yes.
Thank you.
Hello, everybody. I want to thank Kim and Rose for their wonderful presentation, and I want to thank everybody for joining us today on this webinar. I'm so glad that this is happening because so many of our Native populations, like Rose had pointed out in one of her latter slides, that we are invisible in regard to policy and services and funding. We're also invisible in regard to how mental health practices, best practices in regard to social services don't really address, how do you incorporate and address all the traumatic history that we've experienced. And that became very real for me in my very first case, and my very first case with a Native American client. So on the other end of the spectrum, while we're invisible in regard to funding, policy development, and best practices, we are overrepresented and too visible. And so for the general public, that then feeds into further alienation and marginalization of our people. And the client that I worked with, we're going to go ahead and just refer to her as Lee. She was a classic representation of all of these issues. So it's really, and I was so glad to see all the structures defined in regard to how we as Native Americans, how we have to transverse and know how to access. And sometimes we don't even know how to access some of the services or how to go about it. So we get frustrated. And so that then leads into why we are faced with that initial suspicion from clients. So it's very, very important that you work on developing a relationship. And that's, for me, that's very cultural. I was brought up that way. You don't just jump right into business right away with people. You sit with them, you offer them food. And with our clients, they're oftentimes, like Kim mentioned in her slides, we are overrepresented. We have high levels of homelessness, and we have a high population in urban areas. So they oftentimes face closed doors, oftentimes because they also present with untreated mental health issues. They are self-medicating, so they struggle with chronic long-term addictions oftentimes. So they are then 86th, closed off to services. So that's part of your job too, as a SOAR provider, is to making sure that you advocate on their behalf. The individual that I worked with, she had many doors closed to her because she was unfortunately actively psychotic and very heavily addicted. 10 years of chronic alcohol and methamphetamine use then led to a severe medical issue that she could not address until she sustained a level of abstinence. Therefore, 18 months of work, and here we are 18 months later, and she's been able to obtain the major surgery. She's established abstinence, but it took a lot of advocacy, and also keep in mind that you have to build, because a lot of times our individuals have been ostracized from their cultural family, their tribe, and their homelands. So they are very visible, but yet marginalized. So it's so important that you build into your services, you start the SOAR process. Yes, you have to kind of help them reconnect to themselves by, first of all, identifying their strengths, their opportunities, and that begins with identifying their political and legal status, because it can open many doors. And you also have to be aware that it's going to present some barriers for you as a SOAR provider, because you need to start that search right away, and you need to learn, you have to know how to access records, and you have to develop a network. And it's important to know, like I said before, part of an individual's identity is not only their legal status, but it's their cultural identity. And for many of our individuals, they're disconnected from that cultural sense of self. So starting, forming a team of, really active providers. I was really fortunate with this case because she had a medical provider on the county level that was absolutely just committed to making sure that she got this surgery. And I had wonderful providers within my own agency who were willing to be flexible with me. Going back to what Kim said, it's so important to be flexible. And our program, my path lead was really flexible with me and allowed me to kind of, when our client disconnected from services, she then allowed me the time and space to be able to reconnect with her and get her back on, getting her back on the road, getting her back on her path. So this next slide is really important in regard to collecting records and vital documents, because oftentimes we have tribal members who don't utilize IHS because of the stigma surrounding mental health issues. So oftentimes we end up with tribal members who have been ostracized, and they end up in urban areas such as Billings, because we're so close to so many different reservations. So we have to be able to address the materialism of addiction in regard to their mental health. So this was a challenge for me. When I first met, I was meeting with her for the first 3 months. I couldn't even comprehend what she was saying. So oftentimes she would present and only engage with her hallucinations. And I was frightened. I remember sitting there going, I'm not sure where I'm going with this, but I do know that I have to be consistent for her. And when she shows up, I would make sure that I would get her food, get her something to drink. And I would just focus on the A in access within the SOAR model. Okay, we got to start where she's at. She's hungry. She doesn't have any shoes on today. She looks like she has some medical needs. So being able to then figure out, okay, who are you seeing? Who's your provider? And it took me a while just being able to, I had to focus on just very preliminary services. And it got to a point where I had to be really honest with her and tell her, I'm sorry, but your substance use is really standing in the way. What can we do? And that catch-22 as far as, do you treat the mental illness first, or do you treat the chemical dependency? So I made sure that I helped her access, and I had to go with her to most of all her appointments, because like I said, if she happened to go to her appointment without me, I would have providers calling going, Lee's here, and she's, being a little aggressive or we're not sure, if maybe she needs to go to the emergency room and be checked in the psychiatric unit. So I would always make sure that she met me at a place and gave her some transition time and checked in to see if she could make appointments. So once we got to that place, I then was able to identify who her important family members were, determine, and at that point in time, she wasn't even certain where she went to school, if she had an IEP. She didn't know, but there was some indication that she had been in the foster care system. So I had to determine where she had been domiciled. Where did she likely receive services if she was domiciled on the reservation, because then that would mean it was either tribal health or IHS. If she was in foster care with BIA, with Bureau of Indian Affairs, I had to find out who her worker was. And because she had mentioned some residential care facilities in the Eastern Montana area, I was aware from my previous work with BIA that she more than likely had been placed by BIA Social Services. And that was, I think, next to getting her into services and making sure that she knew she could trust me and I was reliable and she could depend on me. Learning how to access those records to speak to the materialism of her substance dependency was the most difficult part of this case. And it took a lot of networking, a lot of phone calls, just being able to ask questions, calling people that I knew and going, do you have any idea how, who the information officer is for BIA? Do you know where archived records go? So these are the things that I learned at the end of everything. And it really did, being able to locate records, that was a feat. And I have to say, I have to pat myself on the back because that was a lot of inquiry and a lot of research. And along the way, I managed to build networks and introduce the SOAR model, explain how it can be useful, what our process is and how they can be helpful. So knowing that she had received services at her local service unit, I then knew what hospital served her service area. I then went to their contract health, I went to their medical records, and I just kind of went up the chain of command, and it ended up at the regional level. And just like Kim said, if you just go to the different websites and just kind of peruse, and I just kind of went, well, informational officer, I know that they probably deal with like large public records requests, but maybe she would be able to tell me, or this official in this role could tell me where I go for archived records. And so I managed to really build a lot of collaborative relationships with people along the way. And her family members were very, very helpful. And so towards the end, I was able to tap into a lot of the resources because I knew there came a point where she realized that she could not, there were too many triggers in the Billings area for her. So I started reaching out and she started working, and we worked as a team. Engagement with her was, and I interviewed her to find out what I did specifically that kept her engaged and built trust. And she said to me, in the beginning, I didn't know if you didn't like me or if, and this, I think a lot of people will find kind of unbelievable. And to me, when I first heard it, I was like, yeah, I know that's a, you know, a thing, but I didn't even recognize it in this case. But there are traditional enemies in certain regions. And so she's a tribe that historically they were enemies of the Crow. And so she believed that initially I wasn't doing all the paperwork and just doing all the busy work and submitting documents and just do it already. And I kept trying to explain to her, but she wasn't understanding that I had to address the materialism and I had to make sure that she had access care. She was consistent with services and she was in working towards recovery. But in the end, she said, Mylene, it was your perseverance. You were adamant. I saw you not give up. You kept me informed. You let me know everything. And the one piece that I didn't even recognize was she said, you made me believe that I could be independent and that I could do this. And the one thing that I did was, and I remember doing this and thinking, oh, when she gets this tax return, she's just going to go and spend it. And I don't know if it's going to result in her relapsing, but I had to trust. I mean, just like she had to trust me, I had to trust her. And that one thing she said that I, by doing that, reinforced her belief in herself that she could be responsible and take care of herself. And when I interviewed her yesterday, she just said, I will never, ever forget how much you worked and how hard you worked and how you believed in me. And her whole team. I mean, I think through my advocacy and people seeing the change in her, it was just an amazing thing. I mean, this process, I think from here on out, any other SOAR case I have is just going to be a cakewalk.
Amy, that's a great story. And it is being decided right now. The case was submitted with a really nice MSR. So it's being decided as we speak.
Yes, it turned out to be a mini novel,
but you really took the time to tell her story. And I think in our pre-interview, you talked about the food box that you shared. And I think that's illustrated with giving her the space and the pacing, like Rose talked about, to give her the bandwidth to be able to tell her story to you. Absolutely. In a trusting way. So Mylene, thank you so much for sharing. I think it's time now for some Q&A, and let's get our presenters back up on camera if you're able, and we'll take some questions that came in. I just want to thank everybody in advance for your presentations. They were really wonderful. We had some great questions come in. I think this one is very general, but probably very typical of the types of questions that are out there. So this question comes from Sandy. I'll open this up to definitely Rose and Kim. How does this information help those of us that are in rural areas where there is lack of assistance for the Native American population? And you know, that's really general, and you shared some resources. But can you just kind of generally help out for folks in those more rural areas, how to get some buy-in in Native communities? Kim?
Yeah, that's a tough one. There is a real lack of resource, because there is a real lack of resources available for the Native communities that live there. Unfortunately, like what we put out, all of the resources that are provided by the Bureau of Indian Affairs, IHS, even though they're minimal, that's really what is available. So what you'll find happening is people having to drive long distances. Like when we work with people on the community level, they spend a lot of time in their cars, and that impacts like them getting back to you, and then, you know, how they're working. So there's a number of things that create those barriers, and it's the distance, it's the lack of resources, you know, financially having to drive around and get to those places is also difficult. It takes getting like really creative and doing a lot of research and finding and utilizing the limited resources that are available. But, you know, everything that we put out is those agencies and those organizations are serving those reservation populations. And it's also worthwhile to note that because of like the lack of data and the way that the Native population has shifted, everybody now, most people are now living off reservation, but the federal budget and support, like 1% of it goes to the urban community, and then the rest is reservation based. So, and that's even lacking. So you're really getting a sense of what a struggle it is to get, you know, preventative services and treatment and housing. It's all very limited and difficult.
And I'll just give a plug for Abby. Reach out to Abby Kirkman at the TA Center, who is our subject matter expert in rural communities and reaching out to Native communities too. So reach out to Abby. And we also have available to us, Kim and Rose, too, to help with any of those issues. If you want to kind of develop an action plan to do more outreach into Native communities. So please don't hesitate to reach out to us. Everyone's contact information is available on the slides too. Yeah, so here's another question that we got from Rachel. What if you are encountering a Native individual at the community agency at which you work? Should you ask if they are working with some of these places and make connections with them if they are not? So you shared some great resources that I think folks will start to kind of look into, maybe some more of these agencies. But if you do encounter an individual at your agency who is a member of one of these federally recognized tribes, how should you approach and what should you ask them? Like Maylene said, do you receive services at IHS? You know, how should you approach? What would be, and maybe we'll ask Rose if you want to jump in first.
Sure. So I have been that person that is the Native at a federal agency, and providing the training and technical assistance. And you know what? When I've been approached just by, you know, people coming up and asking me just even general questions like, hey, I'm working on this. I have a few questions, and I'm wondering if we could sit down and maybe approach this together, has kind of been the way that I've, you know, met with people and discussed what they're working on and what I'm working on, and where we can kind of collaborate, or if they have questions, or, you know, and just we see where our work intersects and how to, you know, move forward. I wouldn't just reach out to, you know, tribal communities or organizations without knowing what the parameters of the work around. So I think it's really a work in organization specific question as well. But it's better to ask questions than not to.
And I know Kim had mentioned, do that research beforehand.
Yeah. I would note that, you know, the Native community is small, and at some level, we all know each other. And so I think we're all used to that. Like Rose had mentioned, we're used to people asking us questions. I would go in, be clear with your intentions, and without judgment or any generalizations about what you like, the information that you're seeking. And I'm certain that that person would be helpful at guiding you in your approach.
And also outreaching to the Social Security Administration, the federal agency which administers SSI and SSDI. What kind of tips do you have for reaching out to your local Social Security office, especially in areas where there are urban and rural, Native communities, and debunking some of those myths around applying for these federal benefits for which they are eligible for. Any tips on, including your Social Security office in terms of helping you with this outreach?
Yeah, Pam, I can take that and start off with it. So I think that many of the Social Security offices that work in or around Native communities, especially those that are more rural, will have video conferencing abilities. They'll also have tribal liaisons. I know that for many of the Native and tribal conferences that I'll attend, Social Security always has a presence there. And typically they have a team that is dedicated to working with that population. I would also say reaching out to your SOAR TA Center liaison whenever you're having trouble or would like to make that connection to talk with them about SOAR or otherwise just to connect folks can also be a huge help. And similarly, when we're talking about Native communities that are more urban, oftentimes they'll have easier access to the local Social Security office, and there should be some type of representation there that can assist.
Thanks, Ty. Thanks so much. Again, thank you. We're getting some really great comments. And we have one question before we have to end for today. So this is about the survey data that Rose was talking about hidden homelessness. So in survey data regarding hidden homelessness, I'm wondering if and how questions tease out doubling up versus cultural differences around living with family. She's specifically wondering if multi-generational homes get unintentionally counted as hidden homelessness. Is that something, Rose, you can opine on?
I think I'm going to bounce that one to Kim.
Yeah, this one is tricky because of those nuances and how a lot of Native people perceive homelessness. You can ask this question in a number of ways, and the response you'll get is, we don't have homeless people. I think you really need to frame it in the difference and be very specific in defining like being street homeless and what doubling up means and not having a permanent address. And so thinking about it as a lack of secure space or a lack of secure permanent place to live, because the universal response is like, we don't have any homeless people, because they're thinking of street homeless. And people are also so used to this environment where everybody is doubled up. It's like the norm. So you have to just kind of help them reframe how they think about that.
Okay. Thank you for that. As you can see, we are running out of time. We never have enough of it. Here again are our tools that we want you to check out. Some of the resources for EIA and IHS. So check that out as well. Please reach out to your TA Center, Abby Kirkman, for sure. She'd love to talk to you more about this. We have a webinar evaluation. Please take the evaluation. We also have a question if you do want more information on how to connect to this the Native American community. We ask that you leave your name and your email, and we'll get back to you too. So again, I just want to thank all of our presenters today, Kim, Mylene, Rose, and Abigail, for giving us your time, and we look forward to continuing the conversation. So again, thank you so much and have a great rest of your day.